Bob, I want to take you back to 2018 when you were sitting in your kitchen, I believe, and you felt a pain in your chest. Can you describe to us what it felt like?
It actually wasn't a pain, it was a discomfort. It was a mild burning sensation across my chest, didn't penetrate through to my back, almost on the surface of my chest. I questioned it because it was something I had never experienced before. It was a very unusual sensation. It wasn't a pain in my heart or the usual things associated with a heart attack or a heart problem.
And did it go on for a while?
Yes, it did. Yes, in fact, I sat for a few minutes and had a glass of water, and it wasn't abating. And that's when we decided to take some action, calling the PCP and further.
And you went to a hospital?
And yes, and that he suggested we should go to emergency, yes.
Now, I do believe that they drove to the hospital. If he had been your patient, Lou, and he had called you experiencing this feeling, what would you have told him to do?
So, first of all, it's not unusual for patients to say, I didn't have a pain. They'll say it's a sensation, a fullness, a pressure, because people associate pain with like a gut-wrenching type thing.
How about that burning sensation
Burning
we hear?
is still a worrisome thing. It's a chest symptom that wasn't abating even with rest. So I would have said exactly what his PCP said is, you need to go to the emergency room by 911. And the reason why I say that, and I understand what you and your wife were trying to do, and you didn't want to use an emergency surface, but emergency surfaces are designed just for something like this. Because the problem is if it's a cardiac event, they can start the necessary protocols that are there because time is tissue, right? If you're having a heart attack, you want to make sure you're doing something to try to preserve whatever tissue is at risk. And sometimes bad things happen. You go into cardiac arrest. They have all that equipment there. That's what they train for. That's what they are ready to do. So always you have anything where you have a cardiac issue or severe bleeding or stroke symptoms, neurologic, that's what 911 is for.
Time is of the essence.
Right, you're getting your emergency care starting right at your front door rather than in a 20-minute ride. They can go through red lights, you can't do that. They can do all this stuff, but they can get you there as quickly as possible. So it's really important that they do that.